How do you spot EPTB symptoms in childhood TB? Imagine trying to find clues to a hidden illness in a child's body. Extrapulmonary tuberculosis, or EPTB, is a form of tuberculosis that affects organs outside the lungs. Since it doesn't always cause the classic cough and chest symptoms, recognizing it can be tricky. But understanding the signs can help catch it early and prevent serious complications. Children with EPTB often show general signs of illness. These include a persistent fever that doesn't seem to go away, unexplained weight loss or failure to grow properly, and night sweats that seem out of place. They might also seem more tired than usual, less playful, or less active. Poor appetite is common, and children may complain of feeling unwell overall. Swollen lymph nodes, especially in the neck, are another important clue. These lumps are usually painless but can sometimes become tender or form abscesses if the infection progresses. Since EPTB can involve different organs, symptoms can vary widely. For example, if the lymph nodes are affected, you might notice painless swelling in the neck area. If the brain and spinal cord are involved, symptoms could include headaches, irritability, or sleepiness. In infants, bulging soft spots on the head or seizures may be signs of meningitis caused by tuberculosis. When bones or joints are affected, children may experience pain, swelling, or difficulty moving the affected limb. If tuberculosis affects the lining around the lungs, children might have chest pain, shortness of breath, or cough, especially if there is also lung involvement. One key point is that, unlike pulmonary tuberculosis, children with EPTB often do not have a persistent cough. This can make diagnosis more challenging because the usual signs of lung infection may be missing. Instead, the symptoms are often more subtle or mimic other illnesses. For example, a child with unexplained fever and swollen neck glands might be mistaken for other infections or lymphadenitis. Neurological symptoms like irritability, vomiting, or seizures in young children should raise suspicion of tuberculosis affecting the brain. Because these signs can be mild or resemble other diseases, any persistent or unexplained symptoms in a child, especially those at risk for TB, should prompt a thorough medical evaluation. Early diagnosis is crucial because, if left untreated, EPTB can become severe or cause lasting damage. Healthcare professionals will typically use a combination of clinical examination, imaging tests like ultrasound or MRI, laboratory tests, and sometimes tissue biopsies to confirm the diagnosis. Children who have been exposed to TB, are immunocompromised, or live in areas where TB is common need careful monitoring for these symptoms. Remember, each child's experience can be different, and symptoms may not always be obvious. If you notice any persistent signs like swollen glands, neurological changes, or unexplained weight loss, consult a healthcare provider promptly. They can perform the necessary tests and start appropriate treatment, which usually involves multiple medications over several months to effectively cure the infection. In summary, spotting EPTB in children involves paying attention to systemic signs like fever, weight loss, and night sweats, along with organ-specific symptoms such as swollen lymph nodes, neurological changes, or localized pain. Because symptoms can be subtle and varied, maintaining a high level of suspicion and seeking medical advice early can make a big difference in outcomes. Always remember that proper diagnosis and treatment under medical supervision are essential for managing childhood tuberculosis safely and effectively.